Okay, guys, before we start, let me ask you a question. How many of you think that Viagra is the only solution for getting solid erections back? Well, you're going to be surprised because in reality, more than 70% of erection problems can be improved naturally without medication. And I'm going to show you exactly how to do it. Hi, gentlemen. I'm Dr. Elody Martinel, a urologist with over 20 years of experience. Today, I'm going to talk to you about what really boosts the strength of your erections. And honestly, it's not what most people think. So stick with me until the end because I'm also going to answer that famous question about olive oil and hot tomatoes that many of you have asked me. First, subscribe to my channel, Dr. Elody Martinel. Don't forget to turn on the little bell to get notified for every new video. Trust me, you don't want to miss what's coming next. Okay, we all know that a strong erection is essential for a fulfilling sex life. It gives you confidence, satisfies your partner, and most importantly, it makes all the difference in your quality of life. But here's the thing. Many men, especially after 50, start noticing that it's not like it used to be. And that's normal, gentlemen, but it's not inevitable. After 2 decades of practice, I've seen thousands of patients regain a normal sex life simply by changing a few habits. No magic, no miracle pills, just concrete solutions that really work. So let's analyze together the factors that most affect the rigidity of your erections during sexual intercourse. First factor, and it's the most important, the amount of blood that flows into your penis. That's the foundation of everything, guys. The rigidity you feel during an erection is directly linked to the amount of blood flowing into that genital organ. The more blood there is, the harder the erection. It's as simple as that. Factor number one, blood circulation, the base of everything. But how do you increase this blood flow? Well, the answer is in your lifestyle. A healthy lifestyle promotes blood circulation throughout your body and therefore in your penis. I'm talking about a suitable diet, regular physical activity, and a few other elements we'll look at together. On the diet side, there are foods that are real boosters for your erections. And no, I'm not talking about weird or hard to find stuff. I'm talking about foods you can buy at your local supermarket, like arugula, for example. This little green vegetable contains natural nitrates that turn into nitric oxide in your body. And nitric oxide is the king of vasodilation. It opens up your blood vessels like a highway. Watermelon is also excellent. It contains citrulline, an amino acid that improves circulation. Dark chocolate with at least 70% cocoa. It's good for the heart and for your erections. Nuts, almonds, hazelnuts, rich in arginine, another amino acid that promotes blood flow. And beets. Honestly, they're a superfood for circulation. The 5 superfoods for your erections. But hold on, we'll come back to olive oil and hot tomatoes in a few minutes because that's a question many of you have asked in the comments. Now, let's talk about physical activity. You don't need to become an Olympic athlete, gentlemen. What you need is a combination of strength training and cardiovascular exercises, physical exercises, the winning combination. Cardio exercises like brisk walking, cycling, swimming, they get your heart pumping and improve your blood circulation. Strength training helps maintain your muscle mass and tone, which is beneficial for circulation. Ideally, 30 minutes of physical activity 5 times a week. It could be a simple brisk walk in your neighborhood or a bike ride. No need to go to the gym if you don't feel like it. The key is consistency. These combined exercises are really the best way to improve circulation in your penis and throughout your body. Next, you absolutely need to reduce your daily stress. Chronic stress is a real erection killer, guys. Seriously, find activities that relax you. It could be fishing, gardening, reading, meditation, whatever. The essential thing is to decompress regularly. And then there's sleep. Sleep is crucial, gentlemen. If you don't sleep enough, you don't produce enough testosterone. And testosterone is the ultimate male hormone. It's essential for having hard and lasting erections. Your body produces most of its testosterone during deep sleep, especially between 10 p.m. and 2 a.m. So, if you want to maintain a good level of testosterone in your blood, aim for at least 7 to 8 hours of sleep per night and try to go to bed before midnight. No, I know it's not always easy with Netflix series or late night soccer matches, but trust me, your sex life will thank you. Why sleep is crucial for testosterone? Okay, these factors, blood flow, diet, exercise, sleep, are probably what matter most for getting blood flowing properly into your penis and giving you a rigid erection suitable for sexual activity. But there's another super important element that isn't talked about enough: your level of arousal during the act. The more mentally aroused you are, the stronger your erection will be. It's as simple as that. Your brain is your biggest sexual organ. Never forget that. The role of mental arousal and ambiance. The overall atmosphere counts a lot. You need to feel good with your partner. If you've already built a relationship, complicity, when there's chemistry, trust, you're naturally more aroused, and that translates into firmer and stronger erections. The context before sexual intercourse is crucial. Foreplay, gentlemen, it's not just for your partner, it's for you too. The more time you take to build up arousal, the more satisfying your erection will be. Never neglect this phase. It's what makes all the difference between an average erection and a quality one. Now, let's talk about something many men experience but few dare to discuss: anxiety and stress related to sexual performance. It's a vicious cycle, guys. You're afraid of not performing, and that fear itself sabotages your erection. When you're anxious, your body releases adrenaline. And adrenaline, honestly, is the number one enemy of penis rigidity. Why? Because it causes vasoconstriction. Basically, it tightens your blood vessels and blocks blood flow to your penis. Result: no blood, no erection. It's mathematical. Anxiety and stress, how they sabotage your erections. This anxiety can be caused by many things. The fear of failing again, like that time it didn't work, excessive expectations, setting the bar too high, unresolved relationship issues. All of that creates stress, and that stress prevents a firm erection. Depressive states also play a huge role. When you're in a period of deep sadness or depression, you simply don't have the necessary libido. Sexual desire is low, and without desire, it's hard to achieve the necessary rigidity. Any psychological or emotional disorder can impact the quality of your erections. If you're in this situation, gentlemen, talk about it. Consult a doctor, a psychologist, a sexologist. There's no shame in asking for help. On the contrary, it's a sign of courage and determination to get through it. Okay, now I have to mention something important. Certain medications can really work against you. I'm not saying you should stop your treatments, be careful. But you need to be aware and talk to your doctor about it. For example, medications for high blood pressure like diuretics such as hydrochlorothiazide or chlorthalidone. They're known to make erections more difficult. Beta blockers like propranolol or bisoprolol can also affect the rigidity of your penis. Certain antidepressants, too, the SSRIs, selective serotonin reuptake inhibitors like paroxetine, sertraline, or citalopram. They can really impact your erectile function. It's a fairly common side effect, unfortunately. Medications that affect erectile function. If you're taking one of these medications and notice difficulties maintaining a good erection, talk to your doctor. Never change your treatment on your own, but there are often alternatives or possible adjustments. Your doctor can modify the dosages or suggest another medication with fewer side effects on your sex life. Another factor that's often overlooked, the quality of your relationship. If you don't have a healthy and fulfilling relationship with your partner, it's very hard to feel enough arousal during the sexual act. Tensions, unspoken issues, reproaches, all of that kills desire and arousal. A bad relationship creates stress, emotional distance, and that directly reflects in your intimate life. You can't have a great erection if you're in constant conflict with your partner. It's impossible. The role of mental arousal and ambiance. Note, this seems repeated, but integrated smoothly. So, how do you solve all these problems? Well, first you need to identify the cause. What's your main issue? Lifestyle, stress, medications, relationship. If it's your lifestyle that's unhealthy, change your diet. Incorporate the foods we talked about: arugula, watermelon, dark chocolate, nuts, beets. Exercise regularly, a combination of cardio and strength training. Reduce your daily stress levels. Sleep enough, at least 7 hours per night. If it's your medications, consult your doctor to see if there are alternatives. If it's your relationship, take the time to talk with your partner. See a couples counselor if necessary. Work on your communication, your complicity. You can also improve your social life in general. Go out, see friends, do activities you enjoy. A happy and balanced man in his life is a man who has better erections. It's as simple as that. Okay, now let's answer that famous question about olive oil and hot tomatoes. Many of you have asked me, Doctor, does taking a tablespoon of olive oil before bed or eating 4 hot tomatoes really help? Well, honestly, it's an excellent question. Extra virgin olive oil is indeed very good for your cardiovascular health. It contains monounsaturated fatty acids that improve the health of your blood vessels. It reduces inflammation and improves circulation. So, yes, olive oil is beneficial for your erections indirectly. A tablespoon in the evening before bed? Why not? It won't work miracles overnight, but in the long term, as part of a balanced Mediterranean diet, it's certainly positive. The important thing is consistency and the quality of the oil. Choose extra virgin, cold pressed, good quality. Now, hot tomatoes. Tomatoes, especially cooked ones, are rich in lycopene. Lycopene is a powerful antioxidant that protects your blood vessels and improves circulation. Several studies have shown that lycopene can indeed have a beneficial effect on erectile function. 4 hot tomatoes might be a lot for one meal, but the general idea is good. Incorporate cooked tomatoes into your regular diet. Homemade tomato sauce, roasted tomatoes, tomato soup, ratatouille. Vary the pleasures. Lycopene is better absorbed when tomatoes are cooked with a bit of fat, like olive oil actually. So there you have it. The combination of olive oil and tomatoes isn't a myth, it's based on solid scientific principles. Will it solve all your erection problems? No, of course not. But as part of a comprehensive approach with all the other factors we've mentioned, it can certainly help improve things. The key takeaway, gentlemen, is that correcting all these factors, improving blood circulation in your penis, makes all the difference. If you address the elements I have mentioned, I'm convinced you'll regain strong and satisfying erections. It's not magic, it's science and common sense too. Take care of your body, manage your stress, communicate with your partner, eat healthily, move regularly, sleep well. Everything is connected. And don't forget, if you have persistent problems, consult a urologist. There's no shame in it. On the contrary, it's the responsible approach. We can do tests, identify the problem precisely, and find solutions tailored to your specific situation. There you go, guys. I hope this video was helpful. If it was, remember to like it, share it with friends who might need it, and especially subscribe to my channel, Dr. Elody Martinel, so you don't miss any of my upcoming videos on men's health. Leave your questions in the comments. Have you already tried some of these methods? What worked for you? Share your experience. It can help other men in the same situation. Take care of yourselves, gentlemen. Stay healthy and see you soon for a new video.